Thank you, everybody, for joining this virtual Congress in your kitchen. It's normally coffee with your congressman. I'd much rather be doing it with you in a coffee shop in Summit or Westfield or Springfield or Mountainside. And we'll be back to doing that as soon as we possibly can. In the meantime, we get to peek into each other's living rooms and kitchens and see the cool backgrounds. I see the planet Earth one with the sunrise, which is one of my favorites. Thank you. And I think a vineyard with the sea behind it. It's always cheerful to see what people want to show us. So thank you so much. Well, here we are together in the second or third month of this very strange and very frightening crisis for our country. And the toll that we have taken in New Jersey is extremely high, more than 8,000 deaths, and that is just the official number. I'm certain that the actual number of people we've lost in New Jersey is significantly higher than that. And at this point, I think every single one of us has been personally affected, in the sense that I'm sure everybody on this call knows somebody who has passed away or who has been sick, not to mention somebody who has lost a job or whose business is shuttered. And none of that can be taken back. That said, I think through a lot of hard work and decisive action, we have turned a corner in New Jersey. I look at the data every single day, and it's pretty clear that we hit our peak in mid-April. It was a very precarious moment. At a certain point, we were down to about 100 usable, empty intensive care and critical care beds at hospitals in the state of New Jersey, which means we were that close to breaking the system at that point, but we didn't break the system. The curve has bent downwards, and I think the numbers tell a pretty powerful story there. In mid-April, for example, there were about 1,600 people on ventilators in New Jersey. We've got that down to about 1,100 today. Folks in intensive and critical care down from about 2,000 to 1,500. Total hospitalizations down from about 8,000 to 5,000. And that's happened in part because of the heroic efforts of our frontline workers, our doctors and nurses, and many others. But just as important, it's happened because all of us have decided that we would be willing to make personal sacrifices to ensure that our loved ones, our neighbors, fellow members of our community can be safe through this, and to help those doctors and nurses manage this crisis in the hospitals without breaking the system. So I think we can take some degree of satisfaction in that without ever forgetting the terrible price that we have paid. Now, part of the price has been an economic price, and we're all feeling that as well. And that's where I've been focused in particular, and where the Congress has been focused in particular, in the legislation that we've passed over the last month or so. We passed the CARES 1 bill, and then an interim bill a couple of weeks ago that did a lot of very useful, if imperfect, things. Providing direct stimulus payments to individual Americans and their children, providing forgivable loans to our small businesses through this Paycheck Protection, or PPP, program, extending unemployment benefits to a much larger share of the American population, including self-employed people, and enhancing the value of those payments. All of these programs have run into some problems. We wrote this stuff in a few days and tried to put it into action in just a few more days. There were horrible problems, in my view, with the small business relief program. The banks, I guess, predictably favored their larger existing customers, and a lot of mom and pop businesses in our communities got placed in the back of the line. And then we learned that big companies like the Los Angeles Lakers basketball team got PPP loans in the first round. So when that program ran out of money and a lot of people said, just throw more money at it, a lot of us, including me, said, no, wait a second, we got to fix this. We have to make it work better. And so in that interim bill that we passed a couple of weeks ago, we not only provided a lot more money, which it needed, but we also set aside a big chunk of it for smaller community-based banks, for credit unions, for banks that are used to dealing with smaller customers. And I think a lot of us talked the fear of God into the banks that were implementing this. And we've seen in the second round of funding that things still not perfect, but they've gone a lot better. So for example, the average loan size, the first round was over $200,000. It's down to about $79,000 right now, which shows it's much smaller businesses that are actually getting this money. And in New Jersey, as of May 1st, when we got the first figures from the Small Business Administration, we saw that more than twice as many businesses in New Jersey had been awarded funding, even at that early stage of the second round, than had gotten funding through the whole first round of this, more than twice as many. And I've been hearing from a lot of small business owners who were very frustrated during the first round, but who have begun to see their relief payments in the second round. Not all, I want to be very clear about that. We still have problems, and my office is still helping a lot of people. Same with unemployment compensation. The system was broken at the New Jersey level and virtually every other state in the country. It is not perfect now, but it is working better, and we expect significant improvements in the coming weeks. My office, every single person who's working for me is now going virtually full-time, round the clock, helping individual constituents to make sure that the promises we've made are kept person by person. And in some cases, we've been able to help. In all cases, we've been able to provide a human being who's going to get back to you if you have a problem, listen, and try his or her best to help, which is more than I can say for some of our other government agencies, for banks that people call and nobody ever even talks to them. So that's a commitment I can make to you, that if a constituent has a special need right now, is not getting what they think Congress has promised, then we will do our very best to help. Now that's where we are so far. I'm still not satisfied that Congress has done enough. So as we speak, we're working on another major piece of legislation. The House of Representatives will take the initiative here. We are going to introduce something, and we are going to pass it, and then we are going to send it over to the Senate. One of my #1 priorities in the next bill is to try to get relief to our state and local governments. Not only do they face a big burden in dealing with this epidemic, but their revenues are drying up for obvious reasons because the economy is shut down temporarily. That goes for the state of New Jersey, it goes for our bigger cities, it goes for every single small town in our state. And the first round of funding did not do well by smaller counties and towns because the Senate and the White House were resistant to any state and local assistance, and they attached tremendous restrictions to the money that we approved that made it virtually impossible for a lot of small towns in New Jersey to benefit. So we're trying to fix that. I am one of the 4 chief sponsors of a bill in the House to provide much less restricted relief to states, cities, and small towns, regardless of population size. So that would be hugely important for our district in terms of making sure we can pay our firefighters and cops and school teachers and have the summer programs for our kids and our county fairs and everything else that our small towns do for us. And I can tell you that that concept in my bill will be part of the major bill that we pass in the House and send over to the Senate. And we've been putting a lot of pressure on Mitch McConnell and others in the Senate to agree that we need that state and local government funding. In our district, 55 mayors and county freeholders signed a letter endorsing my bill and urging the congressional leadership to include state and local government relief. Those 55 were about equally divided, Republicans, Democrats, does not matter in our district, or I think really any congressional district in the country. Everybody's facing the same problem. We've all got the same needs. Now, there's a lot of other stuff we got to deal with. There's the post office. There's making sure we have a secure election in November, that everybody can vote safely. There are issues with childcare that we want to take care of. And then I'd say for me, the remaining biggest priority, a lot of other stuff we can talk about, because I think this is the key to getting us out of this crisis, is making sure that at long last, we have what we should have had from close to the very beginning, what the White House has for all of its staff, and that is widespread access to testing for the coronavirus for everybody in the country who wants to go back to work and school safely, with contact tracing and isolation for those who still test positive. There's not going to be a vaccine for this thing for a while. I wish that weren't true. I wish we had one in 2 months, 3 months. It's not going to be the case. The only practical way we can reopen, and we are going to reopen one way or another, is to have widespread access to testing. And New Jersey's still pretty far behind in this. Right now, we're still mostly testing people who are symptomatic for the disease. We're going to have to exponentially increase that over the coming weeks to get to a place where we can safely go back. At this point, I've kind of given up hope that the Trump administration is going to lead that effort, because every single signal that we've heard from them in recent days is pushing in the other direction. The president even said a couple of days ago that, you know, if we test too much, we're going to look bad, which gives you a sense of his mentality. The CDC absolutely wants us to have widespread testing, but the White House is resisting that. Congress has been pushing. They keep resisting. So here's the deal. Congress is going to provide a lot of money for testing. We already have. We're going to do more. But it is going to be up to us. It's going to be up to the states. Ideally, the states working in compacts with each other to make sure that we put that kind of system into place. And I look forward, I'm sure we'll get questions on that. And I look forward to saying more. So we've done a lot. We have made a difference collectively, both government and all of us together as a community, but there is a tremendous amount that we still have to do. And I'm on this 150% of the time. My staff are on this. We are not going to the United States, at the very least, has done its duty at a time of crisis to deliver for the people of the United States and the people of my district. So with that, I am eager to hear your comments, your thoughts, your questions. We'll get to all that we can on this Zoom session, and those that we can't get to here, if you leave them for us in the chat with contact info, somebody on my team will get back to you as soon as we can. So with that, DeAndre, back over to you to lead our discussion. Thank you again.
Thank you so much, Tom. Just another reminder for everyone on the call, if you do have a question, please just use the chat feature at the bottom of your screen. You might need to wiggle your mouse around a little bit to pull up the toolbar at the very bottom. As the Congressman just stated, please include your name and contact information, including with your question. This allows us to follow up after if there's additional follow-up or if we can't get to your question on the call. Tom, your first question. Are there plans to work on a phase 4 of the economic stimulus plan that will provide aid to the state?
Yes, and actually I said a lot about that in my opening remarks. So the next bill that we pass absolutely will provide significant assistance to states and local governments. So you should expect the House to do this in the next couple of weeks. There will be resources set aside for the states. There will be resources set aside for local governments. There will be a specific set aside for local governments of municipalities with less than 50,000 people. And in our congressional district, that is all of the municipalities, all of ours have less than 50,000 people. This is recognizing that although different parts of our state, different parts of our country have different levels of coronavirus infection, but every single municipality, every county, every state where there has been an economic shutdown is facing the same loss of revenue. Revenues that are absolutely vital to pay for just basic things, our schools, our fire departments, our police departments, our parks, all of the community programs that our small towns organize to give us a sense of belonging to a community. All of that is on the line. Small town America is on the line here for no fault of its own. And so we want to be able to do something. You know, we're willing to write big loans to America's major corporations to get them through this crisis. I think the city of Westfield and Summit and Berkeley Heights, you know, we want them to survive as well, because the services they provide are important to us. And so we're going to do our part in the House. And I think, you know, McConnell, who was against this at first, has indicated recently that he understands that something is going to be necessary. And I think he's more in a bargaining and negotiating mode than a saying no mode. So I'm hopeful we'll get something done.
Thank you, Tom. Our next question, before we go to the last question, when will New Jersey have the COVID-19 testing capability to test everyone, or at least the people that want to get tested?
I can't tell you when it's going to be. My job is not to predict it. My job is to promote it. But I can tell you what it needs to be, roughly speaking. Right now, we're testing on average 6,000 to 10,000 people a day. Fluctuates a lot, but that's about the average. That number has not gone up measurably since early April, which tells you how difficult this is. And it's not for lack of commitment. It's lack of capacity, lack of supply, whether it's test kits or the personal protective equipment needed by the people who are collecting the samples, the chemical reagents needed to run the tests. All of those things, as you know, have been in short supply because we didn't prepare as a country. So we got to get that number up very considerably. The governor has said he wants to double it by the end of May. I personally don't think that's good enough. I still think that we'll be in a pretty pitiful state if our goal is to have confidence that we can reopen the economy. There are a lot of public health experts who have said that we'll need as a country to be doing between 500,000 and several million tests a day to get to that place of confidence. If you take the lower end estimates, say 500,000 a day, that's still tens of thousands a day for the state of New Jersey. We'll probably have to triple, quadruple what we're doing right now. Another way to measure this, for those of you who follow it closely, is to look at the positivity rate of the tests that you are taking. That's the percentage of tests that come up positive. If you are only testing symptomatic people, people who have a fever or a cough, then logically the positivity rate is pretty high because you're testing people who are probably sick. If you have widespread testing, where anybody who wants to know that they can safely go back to work or school can be tested, then the positivity rate logically will be much, much lower. Our cumulative positivity rate in New Jersey has been about 39%. That is sadly the highest of any state in America. Our spot rate on a daily basis, the governor just tweeted today that it's down to about 28%, which would be good. The World Health Organization says you got to get it down to about 10% to safely go back to more normal activities. So that's another way to look at it. We got to have enough tests so that only 10% are coming up positive or less, hopefully. The good news here is that we're an ingenious country, and we're now moving full speed in that direction, whatever the White House may want to do or not. Rutgers University, our very own Rutgers here in New Jersey, has developed one of the best newer testing methodologies, a saliva test, which is very easy for people to use. In fact, just today, the FDA approved that test for home use. So you can use it at home with telemedicine, where a doctor could just sort of walk you through it. It's, you know, doesn't require a swab and all kinds of collection methods. It doesn't require all the PPE. So we should be able to reach those ambitious targets that I just mentioned using these kinds of new methodologies. And fortunately, our very own Rutgers University has developed one of the best. So the governor's going to issue a plan in the next few days. I hope it's a good one. And I look forward to fighting for the resources from the federal government needed to make that plan a reality in our state.
Thank you, Tom. Before we go to our live questions, a few more of our neighbors have joined into the conversation. So just to recap, if you would like to ask a question at any point, please use the chat feature at the bottom of your screen, include your name, your question, and contact information so we can follow up after the call if there's additional follow-up. Regarding live questions, when you submit your question, please look at the chat feature. I will let you know when your turn is next. And if you'll be asking the question live. Some questions are a little bit more personal, so we'll take that information and pass it along to our staff so they can get you an answer directly to your situation. But again, once I acknowledge you're next, when we call on you, I will unmute you, and then we'll take your question live with the congressman. All right. Our first question comes from Mike from Mountainside. Mike, can you hear us?
Yes, it's Rob from Mountainside.
I'm sorry, Rob. Go ahead.
That's okay. First off, I'd like to thank you, Congressman, for making yourself available to us today, and I appreciate you being able to take my question.
Thank you, sir.
Thank you. My question has to do with, can you give us an update on the PUA program in New Jersey and when it would be instituted more fully?
Yeah, it's a good question. So that's the newer unemployment compensation program that we put into place that provides an additional $600 a week temporarily for folks who are unemployed because of this crisis, and that extends those benefits to self-employed people, gig workers, independent contractors that normally would not have benefited from unemployment compensation. The system broke down. If you applied, you know this personally, because millions of people besieged our rickety old state unemployment system at the same time. They had no idea how to deal with the self-employed people. They didn't have a system in place for doing that. They didn't have sufficient guidance from the federal agencies. My understanding, and we talk to them every day because we have hundreds of cases of constituents that we are working with them, is that they have now started processing the PUA applications, and that they are close to clearing out their backlog, is what we heard this morning on a call with the governor's office. I don't believe it until I see it. I don't believe it until the folks who have called us, who are frustrated, tell us that their situations have been resolved. As I've mentioned, more people are telling us that the last few days, but not nearly everybody who's come to us to ask for help. And so I know that there's still issues. I think, again, we're in a better place this week than we were last week. We'll be in a better place next week, but we're still not exactly where we need to be. I'll just close with this commitment. This is a promise that Congress made, and I intend, I am absolutely committed to ensuring that everybody who qualifies for this program is going to get the relief that we promised. It may come later than it should have, for which, you know, we're all of us in public office bear our share of responsibility, but it will come. And if you are having particular problems with the system, reach out to us. We'll try to help.
Thank you.
Thanks again, Rob. Our next question comes from John from Garwood. John, can you hear us?
I can. Can you hear me okay?
Yes. Hi, John.
Yes.
Hi. Again, thank you for making yourself available. Congressman, in Cranford alone, and you are well acquainted with the size of the community, we've lost 86 people, according to the State Department of Health, in our long-term care facilities. These residents throughout the district, throughout the state, throughout the country are suffering an unspeakable level of death and illness from COVID-19, and doing so in the absence of forced absence from their families. Yet we hear almost next to nothing about this. It takes a back seat to the economic impact, the antics that go on in DC and everything else. So my question for you, and I hate to ask you to work 160% because I know that you are
it's okay.
Firing on all cylinders on this, but what are you and Congress doing or going to do to make sure that these facilities have the protocols, the staffing, the equipment, the materials, and the other assets that they need to battle this pandemic? Because it is not going to get any better on its own. And they clearly, with this vulnerable population and the nature of this disease, clearly need more help than they're getting.
Yeah, here. I totally agree. And it's important that we keep this in mind when we tell ourselves that, you know what, we're desperate to get a haircut, or to go to the beach, or to go out to our favorite restaurant. I want to do all those things, right? I mean, we all do. It's normal. It's human. I'm impatient. But we got people, we have workers in our senior homes who haven't gone home. They sleep there every single night because they're working so hard and because they're afraid of infecting people back home. And they're dedicated to their jobs. We've got, as you suggested, families who are worried about their loved ones in a senior facility and they can't visit. And it's incredibly painful knowing that there have been, obviously this is a disease that affects the elderly more than it does the young. This is, I would say right now, in our daily conversations with state authorities. And at this point, I'm kind of, you know, I'm working as much with the state authorities as I am with the federal authorities, is because one of my jobs is making sure that those two things are connected. I would say probably their number one priority now is the senior homes. A couple of months ago, it was hospitals, because we had to not allow the hospital system to break. Would have been a catastrophe. We succeeded there, and I think therefore now the attention is turned to these facilities. What are we doing? A lot of it is just resources and supplies. It's making sure that the staff have the protective equipment that they need for themselves and for the residents. We've had significant shipments of PPE delivered to a lot of our senior homes just in recent days. The National Guard is being deployed to a number of senior homes across the state. That is as we speak, and I'm not sure yet if any in our district will be getting National Guard. Obviously, that's reserved for the largest ones that need the greatest help, but to augment the staff at those homes. We've been very concerned about transparency, making sure that families of residents are fully informed if there are cases, if there are problems. That was not happening in every case early on in this crisis. And I think we've gotten that fixed now. But if anybody hears otherwise, please let my office know. And more broadly, if there are specific issues in with a particular facility that you believe should be brought to my attention, please do it. Oftentimes we'll then take it to the county or to the state, but we're all talking about this stuff all the time, and I need to know what's going on in the community. So please don't hesitate. This goes for everybody to bring those things to our attention.
Thank you.
Thanks.
Thank you both. Our next question comes from Lynn. Lynn, can you hear us?
Yes. Hi, Congressman. You mentioned in your opening remarks that a future focus is the Postal Service, and I wondered if you could expand a bit on what you and others are looking to advocate to support the Post Office.
We want the Post Office to survive.
Yeah.
A lot of Americans are realizing just how much we need it right now, because we're stuck at home and we're much more dependent than usual on things being delivered to our home. So of all times to be letting the Postal Service go under, this is about the worst I can imagine. But I think fewer Americans know that the Postal Service is actually pretty well run. They're making a small profit on their mail delivery services. They don't take a penny in taxpayer money to support those services. They're self-financing, but they are burdened by a requirement that Congress laid on them in the mid-2000s to fully prepay their pension obligations for their employees for the next 50 years, which no big company in America has to do. And that's put them in very serious financial difficulty. Again, it's not that they're losing money delivering the mail, it's because they have this additional obligation that Congress placed on them. So we've been trying to change that for some time. And in the meantime, we feel like we've got to provide some relief so that Post Office can continue to provide services at a moment when it's even harder to do so, right? Because they've got to worry about the health of the folks who are delivering our mail, and we want them to do that too. So we're going to try to do that in the bill that we're hopefully going to pass in the next couple of weeks. Again, there was a little partisanship around this in Washington, which I don't think reflects where most Americans are. There may be some bargaining because that's the way things work, but I don't mind as long as in the end we get this done. A very important side note, we can't have elections in America without the Post Office, because lots of folks vote by mail, and a lot more folks are going to vote by mail in November than ever before, precisely because of the crisis that we're experiencing. So that's another reason why we got to get this done.
Thank you.
Thank you so much for asking.
Just a reminder for everyone on the call, I know a few more people have joined in. If you have a question at any point throughout the call, please just use the chat feature at the bottom of your screen. Please include your name, your question, and some contact information. So if there's any follow-up after the question, if we get to it on the call, or if we don't get to it on the call, our staff can follow up offline. Susan, you're next.
Okay. Hi, Tom. Thank you so much for doing this.
Sure. Hi, Susan.
In our house, you're Tom terrific. I
Oh,
just wanted to ask you, are you and your fellow Congresspeople planning to extend the supplemental unemployment benefits after July 31st? Because many people that are unemployed right now really have a hard time even looking for another job until things start to open up. So that unemployment's going to probably last through the year.
yeah.
But definitely past July
I think
31st.
I think you may be right. I don't know what's going to happen. I know it's something that we are discussing for the current bill. I don't know if it's going to make it into this bill. This is probably not going to be the last piece of legislation that addresses the coronavirus crisis. In one way or another, this crisis is going to be with us for a while. And as it evolves, the response is going to evolve. And I think it should be based on need, objective data. I don't want to, I don't think people should be punished because we decided for public health reasons to freeze a lot of economic activity in our country. This is not it's not the fault of any worker who loses their job. It's not the fault of any company that had to shut down. We asked them to do this because it was necessary to save the lives of millions of Americans. And I think we've got an obligation, even if we can't make everybody exactly whole, we've got an obligation to ease the burden of observing these guidelines and restrictions. So I'm for doing whatever it takes to get that done. We have been talking about some different ways of doing it, by the way. Ideally, like from the very beginning, we wanted to use the unemployment system as little as possible. We wanted businesses to keep their workers on their payroll. That's why the PPP Small Business Loan Program was created, to help companies keep their workers, even if their shop is closed. And so, I think that will need to be extended. And we're also talking about different ways of helping companies keep their workers on their payroll. Some of the European countries use their tax system to basically subsidize the paychecks of employees of companies that could show that they were economically harmed by the COVID-19 crisis. And there's legislation that we're going to be trying to move in the House at some point along the same lines, potentially to replace the PPP program. That would also guard against some of the abuses of it that we've seen, companies that don't really need it applying for the forgivable loan. Under this approach, they would have to show that that their revenues are significantly down from this point last year, and we wouldn't need to be using the banks. We've just used the IRS, which already has everybody's information, and I think would be much, much more efficient.
Thank you very much.
Thank you.
Our next question comes from Ellen. Ellen, can you hear us?
Yes.
Go ahead with your question.
Thanks again. I really appreciate this opportunity, and I have to say we've been dealing with your office, and it's been a real pleasure. You've been very helpful as best as you can.
Thank you.
I really appreciate it. I think my question has been handled, but I'll just put it out again. I know you mentioned the self-employment glitch, and from what we saw online is that the form just didn't recognize, there's no way to explain that business dried up because, in our particular case, there's no social gathering. So we can't take photos. So our business is gone.
Yeah.
And we filled out everything correctly, and then we get nowhere. And then they're getting, not to joke, but it sounds like they're getting ready to get set to get going. And it's extremely frustrating on this end because you can't give an answer. Our local administration can't give an answer. The governor couldn't give an answer today. I listen every day. So what we were told today locally is that they're starting, but you'll hear next week. But we don't even know I mean, I don't know why you wouldn't be covered, but self-employed is self-employed. And if there's no work,
Yeah.
I'm assuming we're covered. But would we be covered also with the additional $600 that everybody is getting?
Yeah. So that's for everybody, including self-employed. And that's backdated.
Right, from the time we've applied, which was back in March.
Yeah, so it's a little different for, there's a specific week to which they backdate the $600. And then there's an earlier point to which they backdate the normal unemployment compensation you would get. And my team can give you the precise details if you like. But the good news is that even if you hear late, you'll still get the same amount of money.
So it doesn't matter when we applied, it's universal as to the date that.
Well, it may. That's a. I'll have my team get back to you with the specifics.
Okay.
But it certainly doesn't matter when you hear back, right? So if the state of New Jersey is late in telling you, "Hooray, good news, you qualify," it will be backdated to whenever you were entitled to receive it from that date. So that's the good news. And again, if you're entitled to, you're going to get it. And I'm just sorry that you have to wait longer than any of us intended. This is, unfortunately, the bad news is this is a system that was designed by human beings and done very, very quickly. And I think some of the problems, this is not an excuse, it's just, the reality of life. Some of the problems were probably inevitable just because we invented the system in about a week and gave all these federal agencies plus the state just a few days to figure out how to make it all work for millions and millions of people at the same time.
I just want to bring something up. I was listening to the governor today talking about testing for asymptomatic people.
Good.
And they did bring up that there are two locations, Bergen County Community College and the PNC Arts Center are now allowing asymptomatic testing to be done without a doctor's note. However, I mean, I guess you're on your honors system. They're saying that they really want to test people that have either been, they don't want somebody who's just nervous, somebody who's been exposed to somebody that's still asymptomatic or works with somebody or and is also under the care of a doctor, in the sense that you don't just show up, because if you are tested and it's positive, where does the test go? So of course it matters how many show up as well, because they'll run out of the tests. But that was announced today by the governor.
Well, that's been true for a bit, but look, it's 2 sites for a state of 9 million people.
That was it.
I'm losing patience with this, and I don't blame the governor. He's dealing with a massive shortage of supply of everything you need, and a White House that has categorically refused to accept any responsibility and said the states are on their own.
Amazing.
All that said, it is unacceptable that we are in this situation. We absolutely must be testing asymptomatic people. Absolutely. It is only because we have a shortage, a huge shortage, that they've put that restriction in place. We cannot safely reopen until we have that system. And you hear all these debates like, when should we reopen the economy? It's the wrong question. The right question is, when we're going to reopen it, right? The question is, when that happens, which will not be one day, it's going to be gradual. Are we going to be ready? Have we done enough to be ready to give people the resources to know, am I infectious or not? Because of course, if we could know that, then most people could safely go back, and we could be confident to go out to eat and go to concerts, et cetera, et cetera. And for people who are sick, they're quarantined for whatever number of weeks the experts recommend, and we trace their contacts. Like, we could do that. But A, we didn't start in time, and B, there's resistance at the national executive level to taking any responsibility for it. So it is up to the governor and all of us to make it happen. And we'll
Up
do
to us for November too.
well, yeah, we'll do it. I don't like the circumstances into which poor leadership has forced us.
Well, thank you for all your help.
Thank you, Ellen.
Thank you, Ellen. Can you just provide us with your contact information in the comment section so we can have a staffer follow up on your first question?
I'll also give you my number. I gave you my email, but I'm going to give you my number.
Yes.
So
thank you so much, Ellen. Really appreciate it.
Thank you.
Our next question comes from Andrea. Andrea, can you hear us?
Hi, how are you?
Hi.
Andrea from Union with Rich. My question is regarding the unemployment. It still seems to be pending for a lot of people, including some of my family members. So I'd like to know if you have gotten additional help with that. I know that last call you had said that the IT was being revamped, so you had more IT background, and that there would be more calls answered. That still has not happened as far as I know.
Yeah. So again, the state of New Jersey runs this system. Congress created the benefit and we funded the benefit, but the state of New Jersey runs the system. So then we, as I mentioned, we're talking to them every single day, asking the same thing that you are, and often getting unsatisfying answers based on what constituents are telling me. And we have a lot of folks who have come to us for help with their individual claims. Based on what they are telling us, it seems to be better, but not fully fixed. And I know there are a lot of people in the position that you're in and your family members are in who are still waiting. Can I ask, are they in the self-employed category or?
No, this happens to be family members of mine, and they are not self-employed.
They're not, okay.
And the claim was done, back in March.
In March, yeah. So that's, that's infuriating. I can't blame you for being frustrated by that.
And it also says pending on the site when you call their information, and it has no dollar amount, but it says pending 7 days, and it's been over 7 days.
Well, again, so I'll tell you what I've said to everybody else. You're more than welcome to speak to us separately if you're willing to leave your information. Somebody will get back to you. That we don't work magic, but they do return our calls. Let me tell you that.
Hello, do you hear me?
And so we're willing to go to bat for you, and anybody who lives in our district. So one little problem we've been having is I think my office has gotten a pretty good
Hello, I would like to say something.
For helping people. And so we're getting tons of calls from people outside of our district. And we have to kind of send them back to their representative, because I just can't take on
Heights, I'd like to.
So if you're willing to do that, let us know. And then again, as I've said to other folks, anybody who is entitled to this, if you guys are, you're gonna get it, and it will be backdated to the date when you were entitled to get it. So the total amount does not depend on when they get back to you. It will be what you are entitled to receive.
Thank you very much for taking this.
Of course.
Thank you. Our next question will come from Marlene. Marlene, can you hear us?
Yes. Okay.
Go ahead with your question.
I'm with the American Cancer Society Cancer Action Network. My concern is many cancer patients have foregone a lot of treatments because they're afraid to go to the hospital. Also, due to the unemployment, there's lack of health insurance coverage. What is Congress going to do?
So, stepping back, that question, particularly the health insurance coverage question, reminds us of a problem that we've had long before the coronavirus. This crisis has exposed, once again, some of the inefficiencies and inequities in our healthcare system. The Affordable Care Act was created to help at least a little bit folks who lose their jobs. And if you've lost your job as a result of the coronavirus crisis, well, if you've lost your job, period, then you do qualify for enrollment under the Affordable Care Act. And if your income is below the threshold, you qualify for the subsidies, which are fairly generous for the neediest folks receiving Affordable Care Act coverage. There's also Medicaid as an option for people who qualify for it. None of these things are perfect. They're all frustrating. They're better than what we had before, but they're not perfect. So, if somebody, again, same offer, if somebody's experiencing particular individual problems, accessing healthcare through one of those programs and needs a little bit of help or questions answered, they can reach out to us and we can try to help. But much more important, we need to fix our healthcare system. I would have said that to you a year ago, 2 years ago. We need to have a system where everybody, in my opinion, can have access to a public option like Medicare, no matter what your age is, so that if there are changes in your life, you lose a job, you leave a job, a change in life circumstances, you don't have to worry about your health insurance following you around. You have it no matter what. We need people to have that kind of security.
Thank you, Tom.
Thank you for asking that.
Our next.
And I didn't answer the first part of your question, I think, actually, about people foregoing treatment. And yes, I've heard that from a lot of folks, including from our hospitals. By the way, our hospitals and doctors' offices are also hurting because people are postponing elective procedures. In many cases, they have to. And that's one reason why we also provided a tremendous amount of relief for our hospitals in the last bill that we passed. Obviously, I hope that anybody who needs care will seek it out. If it's not elective, if it's something that you need, the system is still there to help you, and people should not be afraid to seek it out. But I do know that that's happening, and it's distressing. Thank you.
Thank you, Tom. Our next question will come from Anna. Anna, can you hear us?
Yes. Just
go ahead with your question.
Hello, this is Sandy. I'd like to ask a question. Thank you.
So I was just curious if there are two questions actually that I have. One is, are the local governments mandated to use the revenue from the stimulus payments that they get for specific services, or do they have to, they can make use of those as they wish?
So in the CARES Act, the big bill that we passed a while back, we provided relief to state and local governments. But there were two important restrictions. Number one, the local government relief could only go to governments of cities and counties that had a population greater than 500,000. So no town in our congressional district qualifies. In fact, no city in New Jersey qualifies. Some of our counties do. Second, the administration interpreted what we passed as requiring the states to use the money only to pay for things that were very directly related to fighting coronavirus. So if the state had to purchase masks for the state police, that would count. But what did not count was making up for severe shortfalls in revenue because businesses are closed down and not paying taxes. You know, some people say the states just want this money to bail out their pensions and to pay for previous obligations. That's not the case. But they are looking for help to make up for just no revenue coming in. And if you have no revenue coming in, well, you can't do the things that we expect our state and local governments to do for us. So what are we trying to do? We're trying to fix both of those two problems. Number one, we want the aid to be available to all state and local governments in the country, regardless of size. You know, it doesn't matter if you are Newark, New Jersey, or Garwood, New Jersey. One of those two is bigger than the other. They're both facing a similar revenue shortfall, right? Garwood may not need nearly as much as Newark, but it may need a little bit, right, to help it through. So we want to eliminate that population size limit. And number two, we do want to allow our state and local governments the flexibility to use relief to make up for some of those lost revenues. It's not going to be enough to make up for everything they're losing, but something to help them get through this difficult period while still providing the minimum services that we all expect and that are just essential to our lives. So that's what hopefully we'll get. That's what my bill does. My bill's bipartisan. We had strong support from all of our local elected officials, Republican and Democrat, and I'm hoping that we can persuade the Senate to agree to this.
If I may just, it's kind of related, but there used to be a homestead benefit program that would help people below a certain income level to get some kind of assistance with property taxes. Mm-hmm. According to the website that I was checking on, that's been suspended. Do you know if there's any reason for that? Is there any possibility of that being reinstated at some point? I'm
not aware of that. That's a state level issue, but I can certainly look into it. Mm-hmm. I had not heard that, but we'll look into that.
Okay, great.
Thank you.
Thank you.
Thank you both. Our next question comes from Winifred. Winifred, can you hear us?
Yes, thank you so much. So, Congressman, thank you so much for doing this.
Sure.
Just wanted to move to a quieter space, kids home. So my name is Winifred Smith, and I am the senior.
Winifred, you cut off.
Before the pandemic, oh, sorry, can you hear me now?
Yeah, but I did not hear your question, so.
Oh, okay. So I am the, I work as a senior director at 3 family-owned and operated childcare centers, one of which is.
Ooh. You cut off again.
Government, our industry will cease to exist.
Winifred, I didn't hear most of it.
Okay, can you hear me now?
You know what? I can, but probably the safest thing, if you're willing to type in your question in chat.
Perfect.
And then DeAndre will read it to me.
Okay, so, I've done that. So DeAndre, you have it, right?
Yes, give me just 2 seconds and I can pull it right back up. So just reading your question line for line, I understand the 4th stimulus package is coming out. It is imperative that significant dollars are set aside for childcare if the economy is to reopen, because our industry is not going to be able to survive this shutdown. Can we depend on you to advocate for us?
Very simple answer, yes. I strongly agree. I think a lot of us are hearing about summer programs for kids not reopening this summer, which means that a lot of parents are going to have that added burden if they're going back to work at the same time. So we will absolutely need the childcare system to take on an even bigger burden to make all of this work. And so I have advocated for that. Again, I can't promise you what's going to come out of the sausage making process, but that's what I'm pushing for. A lot of my fellow House members are as well. Thank you. DeAndre?
Yes, can you hear me?
Yes, I can.
Okay, sorry about that. Our next question will come from Ray. Ray, can you hear us? I hope I'm saying your name correctly.
Yes. Hello?
Yes, we can hear you.
Okay, great. Thank you. Actually, you answered my previous question was about what could be done, I guess, in the next support bills to help people out who may be losing private health insurance. But maybe since you touched on that already, what do you think of the request to include some sort of liability for employers for going back to work? And is that something that maybe can be used to bargain for other things and such as maybe health coverage expansion in the next bills? Thanks.
Yeah, good question. So when we put forward in the House our proposals for the next bill, including state and local funding, Senator McConnell, the majority leader in the Senate, at first took a pretty hard line and said, no to just about everything. And then he said, okay, maybe we'll consider what you guys want, but here's what we want in exchange. We want to protect employers from any lawsuits that may arise from coronavirus-related issues. Well, I guess we all have our priorities, and that's not mine. And I do worry about situations where an employer might be doing something really egregious. I don't think it's happening in our neighborhood, but I think it does happen where employers are forcing people to come to work without protective equipment, forcing their poorly paid employees to do stuff that's going to put them at significant risk. And I don't know if I want to just give those folks blanket immunity for anything that they might do. That said, I was pleased that the majority leader went from saying hell no to saying there's something I want, because that means we're negotiating. And in any negotiation, my party does not control both houses of Congress, and I'm somebody who wants to get things done. In any negotiation, at the end of the day, you probably accept something of what the other side wants, even if it's not the thing that makes you the happiest. And so I'm willing to negotiate. I'm willing to get something that's not perfect, as long as it includes the relief that the folks I represent desperately need, as long as it makes America on balance a better and safer and healthier place. So, we'll see what happens. I wish I was negotiating with people who had different priorities, but this is the situation we're in, and I'm going to make the very best of it.
Thanks very much.
Thank you both. And with that, I do thank everyone that jumped on the call. I know there's still some questions that are out there, but we are trying to stay true to everyone's time and all of that. So if there are any questions out there that are still lingering, please make sure you use the chat feature at the bottom of your screen. Please include contact information with your questions so our staff can get back to you. I will also post a link or send a link around for the Congressman's upcoming event. We'll be hosting more sessions like this in a variety of different sessions to hopefully get to a lot of questions that you may have. So please feel free to look at that link and always check that in our social media pages for all events that the Congressman will be hosting. Without further ado, I'll turn it back over to the Congressman for closing remarks.
Thank you so much, DeAndre, and just a big, huge thank you to everybody for joining. This is a tough situation, and I know a lot of us on this call have faced setbacks and made sacrifices in the last couple of months. I do want everyone to remember that it's not for nothing. It's not in vain. We are saving a lot of lives by being willing to go through this and to make the choices that we have made. We're making it easier for our heroes on the front line, and we are going to get through this. I think, this is probably the most extensive and inspiring collective effort against a common enemy that Americans have waged together since probably the Second World War. When you think about how many of us have to be working together right now to get this right. And I think, there's no question that we can do this. There is a heavy responsibility for those of us in Congress and in public office to try to ease those burdens and to make sure we've got a plan to get us out of this and back to something that looks like normal. And I will, keep doing this, and I'm going to keep talking to you all the way through. We'll keep on doing these sessions and seminars on specific issues that we'll be inviting you to. So please join when you can. And I can't wait to be able to do it again in person, the moment that it becomes safe to do so. So in the meantime, please stay healthy and please stay in touch. And I'm going to sign off with that.